Total knee replacement is an operation aimed at replacing the knee when more than one part of the knee is worn out with arthritis. Total knee replacement can not only replace the worn cartilage surfaces, but it can also restore poor alignment, deformity of the knee, knees that don't straight out completely, or knees that are bent sideways or inwards. Total knee replacement is a very routine operation. Patients on the whole do very well. The rehabilitation period is slightly longer compared to other knee interventions. Patients are usually independently mobile 6 to 8 weeks. I follow up my patients at usual 2 weeks, 6 weeks, often at 6 months and at 1 year. And I see that patients do improve throughout the first 6 months, sometimes even longer.